Assalamualaikum and hi, my name is Nabila. Today, my friend and I will present about sensory evoked potential. What is its sensory evoked potentials? It is to measure electrical activity in the brain in response to stimulation of sight, sound, and touch. So, when the brain is stimulated, the signals travel along the nerve to the brain. As we can see, SEP also has a lot of advantage. One is help to assess hearing or sight, especially in infants and children. 2. To diagnose disorder of the optic nerve. 3. To detect tumors or other problems affecting the brain and the spinal cord. 4. To assess brain function during in coma. 5. Sometimes confirm a diagnosis of multiple sclerosis. Okay, next we go to the tests that involve in SEP research. The first one is VER, which is a visual evoked response. It can diagnose problems with the optic nerve that affect sight. While the second one is BAER, which is a brainstem auditory evoked response. It can diagnose hearing ability and can point to possible brainstem tumors or multiple sclerosis. And the last one is SSER, which is a somatosensory evoked response. This test can detect problems with the spinal cord that cause numbness of the arms and legs. Then now, we're going to factors that can interfere result test. The first picture is a severe nearsightedness. Second is a presence of earwax. Third, inflammation of the middle ear. And the last but not least, muscle spasms in the head or neck.
Now, let's move on to sensory evoked potentials related disease. First, Wilson's disease. Wilson's disease is a rare inherited disorder which is occur due to the accumulations of copper in liver, brains, and other vital organs. Luckily, it is a treatable disease and many people with the disorder live normal lives. So, what are the symptoms of Wilson's disease? It was divided into three. Firstly, liver disease, which are hepatic encephalopathy, carcinoma, and spider vein. Second, neuropsychiatric symptoms, which are frontal lobe disorder may occur and memory loss. Lastly, other organ symptoms, such as eyes, which is Kaiser-Fleischer-Ring's eyes, renal tubular acidosis type 2, and thyroid gland hypoparathyroidism. Causes of Wilson disease are inherited as an autosomal recessive trait. The second related disease are Creutzfeldt-Jakob disease (CJD). It is a human prion disease and is a neurodegenerative disorder, and its infection may lead to death. These are the symptoms of Jakob disease. First, memory problems. Second, vision problems. Third, sleep problems or insomnia. Fourth, personality changes. And lastly, speech impairment. Evoked potential tests are low-intensity procedure and typically pose little risk to the patients, but it may also feel sleepy if sedations are being used. Skin irritation also may be experienced on the patient's skin due to the electrode placement on their skin.
It's time for electrode attachment. For visual evoked response, the healthcare replaces the electrode along the patient's scalp. It can record the electrical signal as the patient watches a checkerboard pattern flash for several minutes on the screen. The second one is the brainstem auditory evoked response. The healthcare replaces the electrode on patient's scalp and earlobes and delivers auditory stimuli such as clicking noises and tones to one ear. The last one is somatosensory evoked response. So, the healthcare we attach the electrode to patient wrist, the back of patient knee, or other location. A mild electrical stimulus will apply through the electrodes, and the electrode electrodes on patient's scalp is functioning as a recorder.
My name is Sofia Arisha binti Muhammad Zamri, so I will explain about procedure of sensory evoked potentials (SEP). SEP involve 3 tests that measure response to visual, auditory, and electrical stimuli. Procedure of visual evoked response (VER) test. First, you will be seated a few feet away from a screen. Second, a healthcare professional will place electrodes on your scalp over the areas of the brain. Third, you will be asked to focus your gaze on the center of the screen. Fourth, you will then be asked to close one eye at a time while the screen displays a checkerboard pattern. Procedure of brainstem auditory evoked response (BAER) test. First, you will sit in a soundproof room wearing earphones. Second, a healthcare professional will place electrodes on top of your head and on one earlobe and then the other. Third, a clicking sound or another auditory stimulus will be delivered through the earphones. Procedure of somatosensory evoked response (SSER) test. First, a healthcare professional will place electrodes on the scalp and at one or more locations on your body, such as the wrist, back of the knee, or the lower back. Second, small, painless electrical shock will be delivered through the electrodes placed on the body. And the third, for each of the tests, the electrical activity detected by the electrodes on the scalp will be fed into a recorder.
Right, next, I will present about the result of SEP. First of all, result SEP ni ada 3 types. Yang pertama, Visual Evoked Potential ataupun VEP. Yang kedua, Brainstem Auditory Evoked Response or Potential. Dan yang ketiga adalah Somatosensory Evoked Potential. Okey. Untuk Visual Evoked Potential ni ataupun VEP, ini gambar ni adalah result untuk normal pattern reversal VEP. Based on result ni, function VEP ni adalah to record of gross electrical signal generated at visual cortex in response to visual stimulation. Okay. The amplitude of VEP ni antara 3 to 25 microvolt is considerably smaller than that of EEG, which can be as large as 100 microvolt. Okay, next. Next adalah Brainstem Auditory Evoked Potential. Okay, ini adalah contoh result dia. Yang kita boleh tengok kat sini ada nombor-nombor Romans ni 1, 2 sampai 7 ni kan. Apa maksud nombor ni kan? Alright. First, nombor 1 tu adalah distal auditory nerve. Yang nombor 2, proximal auditory nerve. Dan yang ketiga, cochlear nuclei. Dan yang keempat adalah superior olivary complex. Next, yang kelima ni, nucleus of the lateral lemniscus. Seterusnya yang ni, inferior colliculus. Dan yang terakhir adalah medial geniculate nucleus.
Okey, untuk brainstem auditory test ni may indicate damage or disruption to the auditory pathway at specific site. Okey, seterusnya
ialah somatosensory evoked potential. Okey. Test yang ni, test SSER ni can detect problem with the spinal cord that cause numbness of the arm or legs. For this test, the healthcare professional attach the electrode to your wrist or back of your knee or other location lah. He will apply a mild electrical stimulus through the electrode. So electrode on your scalp ni then determine the amount of time it take for the current to travel along the nerve to the brain.
okey, itu sahaja daripada kami. Thank you.